Hi, I'm Dr. James Reilly, and I'm here to talk to you today about the medical and psychological concerns with international adoptions. I'm one of the doctors of adoptioneducationclasses.com, and I'm a general pediatrician in Long Island, New York. The harm of institutions. When I talk to people about children who live in orphanages, one of the things that I think that it's hard for them to understand is that orphanages really are not a good place for kids to live. Usually, the problems are as follows. They can have poor nutrition. One of the things that usually we'll see in orphanages is that the kids will not have the best food in the world. They don't have a variety of food. Food costs money, and usually it's the kind of thing that they're going to be fed food which is nutritious but really just sustaining, not having all the vital micronutrients that children might need. And some children will need more nutrients than others, and those are the kids who usually will see having problems with the diet that sometimes is seen in several orphanages. They'll have developmental delays. They'll have the effect of emotional neglect, meaning that children are made in this way so that way they can have a mother who takes care of them. If they don't have a mother that takes care of them, they're not actually going to grow normally as we would expect another child to grow, and they're going to have actually sequelae from that. They'll have increased exposure to infections, or what I would call like the Chuck E. Cheese kind of syndrome, where children who are going to be around a lot of other kind of children, usually they're going to get all the different kind of various illnesses that you're going to see in kids who are in daycares, etc. They're going to have the lack of a medical advocate, which people don't realize that having a mother who actually knows what's right for a particular child is very important. Usually it's the kind of thing that a mom will be able to know when something is really not quite right with a child, and they'll bring them to see me. A lot of times I see that in my private practice, where the mother doesn't really know what's wrong, but you know something is just wrong. And we'll actually find children have actually serious diseases just on the mom's hunch. Unfortunately, there can be places where sexual predators or people who abuse children will actually go. So usually this will be one of the things that usually the doctors who see these kind of children will actually be looking for, looking to see if they have any signs of physical or sexual abuse. They can have various infectious diseases. Any orphanage anywhere in the world, children will be exposed to various infectious diseases. They will have developmental delay, as we said. Unfortunately, several children will be exposed to alcohol while they were inside their mother's womb. As we know that alcohol, a toxin, which can affect brain growth, so unfortunately we'll see this where actually children will have sequelae for the rest of their lives because of the alcohol that they'll have been exposed to. Post-institutional syndromes, unfortunately when you're inside an institution there are several things that can happen to you. The immunization status is one of the things that we'll be looking at. Many of the places where we'll see children from, their immunizations are not very trustworthy, that when we actually check to see if the children produced antibodies from the vaccinations that they were given, we find that actually they didn't produce antibodies from those vaccinations, meaning that the vaccination did nothing. So it was almost as if they were never vaccinated. So usually this will be one of the things that usually you'll need a pediatrician to kind of figure out. They'll need to know which countries have good vaccines and which ones don't. We'll have to look at the lab tests. In reality, not every country is as good as the United States, which has people to look at their lab tests, make sure that they're done the right way. So we'll have to look to see how does these lab tests compare to the tests that are done in the United States. Alright, so when should I see my friendly neighborhood pediatrician? Usually we'll see them about 10 to 14 days after they've been in this country. We don't want to bombard them with a lot of tests right after they got off the plane. So usually after they've come into this country, usually we let them bond with their parents a little bit, and then hopefully we'll be able to see them about 10 to 14 days later, unless they have some urgent medical problem. Certainly sometimes a child will be, wheezing or have high fever on the plane, and then obviously they have to see a doctor right away. But we'll usually just do a very kind of quick assess to see what's wrong with them, and then bring them back for our full kind of evaluation. Some people, when they come into this country, they believe that the visa exam, the exam that they had to come into this country, is a full comprehensive physical, and that they've discovered everything that there is to know about this child. But in reality, these are just very quickie kind of physicals. It's the kind of thing they're just checking to make sure they're not going to bring some contagious disease into this country. So they're just going to be checking to make sure, for example, that they're not going on the plane with chickenpox or bring Ebola virus or something like that. usually when they come into this country they need a very careful medical evaluation. So what does that mean? Like, for example, I had seen a child who had a medical visa and had all the medical exam for their visa and all these kinds of things, and had been examined in their country by pediatricians, and when they came to see me for their first exam, I noticed that one leg was very significantly longer than the other. So I had to send them to the orthopedic surgeon. This, you might say, is something very easy that anybody should be able to pick up, but unfortunately